Against the threat of an Ebola outbreak, government has announced what appears to be a very drastic decision to cancel all international conferences scheduled to be hosted in Ghana.
That will take place in Ghana for the next 3 months. We believe that the risk is too high, that because we are aware that the risk is high, we want to reduce the opportunities for people coming into contact with others that may bring the disease into Ghana.
According to government, is consistent with that of the ECOWAS sub-region, which has put a moratorium, a 3-month moratorium on all meetings and missions unless absolutely essential and well guided. So what are the implications for international relations? Beyond the ban, how effective can this be in view of existing ECOWAS protocols of free movement of persons and goods? My name is Stephen Anti, and this is today's big story. This big story is brought to you in association with Nationwide PVC, suppliers and fabricators of high-grade UPVC doors and windows. Well, government on Thursday directed the release of 6 million Ghana cedis to fight the world's deadliest epidemic, which has no known cure. There have also been announcements of plans to procure about 10,000 protective gears for frontline workers in health, immigration and other agencies who are most likely to encounter a possible victim. In addition to these, a 3-month moratorium has been placed on all international conferences and gatherings which have the potential of spreading the Ebola virus. Let's hear the Minister of Foreign Affairs, Anna Tetteh, on this directive.
The government is suspending all international meetings that will take place in Ghana for the next 3 months, because invariably most of the international meetings that take place involve regional meetings that have the potential of bringing in visitors from other parts of our sub-region. And indeed, that is another opportunity for visiting people coming into our country and perhaps passing on the virus to others. As I'm sure you are very much aware, the Ebola virus occurred in Nigeria because there was someone who visited Nigeria from Liberia who had the virus, and subsequently Nigeria has also suffered from Ebola. We believe that the risk is too high, that because we are aware that the risk is high, we want to reduce the opportunities for people coming into contact with others that may bring the disease into Ghana. So far, we do not have any incidences of Ebola, and we would like to keep it that way. And I'm sure you would all like us to keep it that way. And so if it means that for now, we suspend any such engagements and interactions, and it is in our own interest to do so, that is what we should do.
Well, already Ebola has claimed over 1,000 lives across West Africa since the latest outbreak in March. Guinea, Sierra Leone and Liberia are the hardest hit countries, while Nigeria has reported a number of cases. We're told that there have been 4 deaths confirmed. But are these enough grounds for government measures, enough grounds for the measures government is taking? Well, I'm getting onto the telephone line now to speak to Professor Kojo Gavoa, who is an international relations expert, to get us some discussions, to start some discussions on the international relations implications. Good evening, sir.
Good evening.
I know this is a very serious decision by government. It has international implications, I reckon. But is this a good decision from the standpoint of international relations? What can you say?
Well, what I would say is that Ghana implementing what has been recommended by the ECOWAS Commission, it's good because Ghana is cheering, and for that matter, the president of Ghana is cheering ECOWAS at this time. So Ghana has to be seen as a country that abides by rules and regulations of ECOWAS. That is fair enough. However, do we have good ground, enough and sufficient ground for counseling all conferences, international gatherings in the country? That one, we probably would have to look at the cost benefits, do some cost benefit assessment before we rush into it. Otherwise, it will be like blocking many opportunities that could come to the country. There is no guarantee that within the next 3 months we are going to be able to curtail the spread of Ebola across the sub-region. Also, there's no guarantee that Ebola will not come into the country from other sources. Now, people who would come in for international conferences, we consider them to be people of a high profile. Are we saying that many of these people would not be tested in their countries or will not be safe in their countries, and for that matter will come into Ghana and spread Ebola?
But is it not fair for us to make such assumptions? I mean, if we're seeking to protect our citizens from any effect of this Ebola or transfer of the Ebola, is it not fair for us to do that, really?
Oh, it is fair, and government has taken other decisions, for example, asking tertiary institutions not to reopen until 2 weeks. And also, this is another step in that direction. However, would that be sufficient in preventing the spread of Ebola to our country? Are we able to man all our border crossings across the country, legal and illegal access routes into the country? Are we saying that we are going to halt all necessary interactions among West Africans? That will be very difficult to do, which means that we are becoming closed society because of the Ebola scare. I don't know if we have put measures in place, apart from the preventive situation, also to think about cure. Otherwise, in the long run, we may be creating another market for other agencies, other nations to develop medicines for the cure of Ebola.
Right. So, Prof, I mean, I do know that Ghana is a signatory to several treaties, including the ECOWAS Free Movement of Goods and Services Treaty. Now, what can governments do or not do when it comes to sensitive issues like tropical diseases under this context, the context of free movement of goods and services?
There are so many measures in place. I believe there are so many rules and regulations in place which have to be enforced on the borders of the nation, not only on the borders of Ghana, but across the ECOWAS sub-region. We cannot say because of Ebola in particular, we have to prevent people from coming in. There are so many other communicable diseases, and people keep crisscrossing the sub-region all the time. What are we doing? Maybe this would awaken all of us to the fact that, look, there could be more serious things on the way. So let's start enforcing the regulations that we have all come to accept.
Right. Professor Gavois, I'll have you hold briefly, and I'll go on to the other telephone line. We're joined by Professor Alex Dodu, who is from the University of Ghana Medical School and a World Health Organization consultant on tropical diseases. Good evening, sir. Good evening, sir.
Good evening.
And thanks for joining us. Now, we have spoken to you before about this whole Ebola scourge. Now, it does appear that government is taking what many people would say is a drastic decision by banning all international conferences for a period of 3 months, which they tell us is consistent with what ECOWAS wants us to do. From where you stand as somebody who is an expert in tropical diseases, are we doing enough in terms of what measures government have put in place and education to the general citizens about Ebola? Are we doing enough to control the potential of any outbreak of Ebola into our country?
I will start by first saying that I'm actually more a consultant for WHO on vaccine safety and medicine safety.
I see.
And not on tropical disease per se.
Thanks for the
correction. But of course, if I chair the WHO's vaccine safety initiative and advise their medicines safety committee, so I'm on the high-level committees.
Right.
Just for clarification.
That's fine.
But coming to the question you raised, last week I was on the front page of the graphic stating categorically on Wednesday that our response as a country to the crisis is poor and inadequate. I would say that since then, I am aware that there has been moves. Indeed, next week, Tuesday, I know in Accra, the Parliamentary Select Committee on Health is going to have a meeting to take things forward. Are we doing enough? I would say we have to do much, much more. Let me take it internally before I go externally. The issue of Ebola broke out in February. What was our response? Well, we feel like it is somebody else's problem, so we did nothing. Indeed, up to last week when I raised the issue, our response as a country has been muted, even though the thing was happening all around us. Now, even as we speak right now on multi-TV, right now, as in to now, even right now, the questions I will pose to you to show how much more we need to do is, should the secondary schools be open? What guidance are we giving them? Should students come or not? And if not, why not? If yes, why? What guidance have we as a nation from one source given to our hotels? What guidance have we as a nation given to people who operate Protour, GPRT, VVIP, and all those things? The point I'm trying to make is that Ghana is very much known for taking things on a piecemeal fashion when we need, one, a coordinated, consistent, and clear message from the highest possible authority in the country. That prevents all the rumors, the noise. Indeed, I did say last week, and I'm still asking, as of now, do we know one single person that we need to contact, whether you are media, the lay person, or whatever, or agency, so that we have clarity on what to do in Ebola? And if this have not been done, then I'm sorry, then I'm worried. Last year, we wrote a book, Honorable Sheraiti then wrote the foreword. One of the things we called for was that we needed to help the Ministry of Health. So we, as a WHO Collaboration Center, with funding from the World Health Organization, produced a manual called Crisis Management and Communication in Public Health Programs in Ghana. Why did we do that? If you don't put your crisis plans in place before the problem happens, then forget it.
Forget it.
And Ebola is becoming like a classical example of how we haven't prepared. We are in a crisis. What is our plan, both for managing the crisis and for containing it? So we have documents. Ghana has all the experts in the world. But one way or the other, leadership has been silent. I have been invited to the meeting next week, and I'll go and I'll mention all these issues again. But what I'm saying is that by now, we should not be sleeping. Most of us in public health should be sitting down and giving the country the direction and the leadership that their tax money deserves. That is the least we should be doing.
Right.
And if that is not being done, then we are in trouble.
Professor Dodo, I'll have you hold briefly. I'll pan back to the studio. I also have Professor Gavois, International Relations Expert, also on the telephone. I'll come to the studio and take some views from the coalition of NGOs who are here with me. Isaac Ampoma. Good evening, sir.
Thank you very much.
I'm grateful that you could make a time to quickly come and join us. I mean, you heard Professor Dodo raising a key issue that our response seemed not to be coordinated. I know that NGOs have been putting a lot of pressure on government agencies, the Ministry of Health, etc., to ask for this kind of coordination. Now, the key thing now today is that government has decided to ban all international conferences amidst other actions that have been taken. Are you content? Are you satisfied with where our protection against this Ebola is going?
That's right. Thank you very much, and of course to the listeners and the viewers. To me, I think it's a failure. It's a failure globally, not only...
Not just Ghana.
Ghana. WHO in itself has not even developed a vaccine when Ebola emerged in 1976. That is where the crux of the matter begins. If Ebola vaccine was to be available, distribution should have come in now.
So you are introducing a different dimension of the global preparedness that in 1970, 1972, when Ebola first broke out, there could have been a vaccine at the time. But nobody anticipated. You were thinking that it's taking too long for the WHO to have not have a vaccine by today.
That makes it a wake-up call. It's a wake-up call globally. And of course, it is very sad that Ebola has affected the hard-stricken poverty, so to speak, continent, which is Africa. And for that matter, West Africa. Various leaders need to also take up the bull by the horn. Ghana, I believe, is doing it best. So far, we haven't recorded a case that we should be proud of. It means our systems are okay.
But Professor Dodu might not agree with you because he feels that we haven't coordinated these efforts effectively.
We will come to that. Compared to the neighboring countries, you realized so far we haven't detected a case.
We're not bad.
That, of course, when you are using that as a basis or a baseline, then it means our health system is on an alert. What then we need to do is to begin to intensify the preparedness. Of course, I support some of the comments that made by the experts, but on the ground, I believe it is time for us to find out, do we even have the funding for Ebola?
Recently, you think government should create a specific fund for
the
Ebola?
enabling environment, you know, the preparedness.
But 6 million Ghana cedis has been announced by government to help in the procurement of protective gear, for example. That's not bad.
Fine, this should be the beginning, you know. But of course, like I'm saying, it's a wake-up call for all of us globally.
But you haven't said whether you are happy or not with whatever actions government have taken so far.
With respect to the ban, I believe it was too harsh. To me, and also from the civil society platform, we could have restricted movement and also set up clinics at the various points, schools, the borders, to check people. You know, outright banned, to me, I think
it's a no-no.
You understand?
It's more like a knee-jerk reaction. Let me go back to Professor Alex Dodu. Prof, he raised a key issue of the vaccine having, the WHO having no vaccine as of the time the first case this year in February, March was detected. This is your area, I mean vaccines. Since the first case of Ebola was detected, what stopped the world in a coordinated effort to try and get a vaccine? Is it because it's an African thing?
Well, I think you could say that in a way, and I mean that so, not because of our color, but because it affected poor people, and the pharmaceutical industry only develops medicines when they can get a market and sell for it and make money. But having said that, I think you raised a very important question. I agree with most of the things except one. Let me start with the agreement. The world failed, but then it is important for listeners and viewers to know that the World Health Organization is actually run by the ministers of health of the world. So the failure of the WHO is because member states, including Ghana and others, did not, at the time in 1976, direct the Director General of the World Health Organization to ensure that a vaccine is developed. In that case, it will be a global coordinated response. So you're so right that there was failure, and the failure is on all ministers of health, whether they are in the UK, US, Ghana, or wherever, because now everybody who is in health is panicking because they failed to act back then. So that is a fact, and that should be laid at the doors of all our ministers for health. And this is not about politics. It's not about NDC MPP. It's about ministers for health representing the world who should have acted in 1976 when the first cases came up. So that is an important thing. No pharmaceutical company, as we see it, might be developing the vaccine, but we need a public-private partnership, or we need the ministers for health to direct that it should be done. And linked to that, let me add an issue which is also linked to money. I heard your speaker say that, well, where is the money? Please, I want to beg that as a country, Ghana, if we are about to die and we say we cannot mobilize local resources to treat Ebola, then we failed as a country.
Then we are a joke.
And here I'm referring to all of us. I mean, look, we can raise money to have a beauty pageant. We can raise money for footballers. We can raise money for, I mean, in my church, we raise money to go and buy bricks and do things. So what I'm saying is that we can be creative in raising money, even without going externally begging. If Ghana doesn't think this is serious enough, so we leave the telephone companies, we leave individuals who can afford to chip in. It is what is needed. It's a coordinating point, a trusted, independent point. That government will say, look, this body is coordinating it. Throw in your money, throw in this, and this has to be spent. That is number two. Number three, and I really want to stress on this, the fact that there is no case in Ghana is absolutely nothing to do with our health systems being very strong. Yes, we have strong health systems in that we attempt to detect and go there. We cannot say we are much stronger than Nigeria or other countries. We are blessed, and we thank the good Lord, we thank Allah. But let's raise this. The fact that there's no case doesn't call for complacency. We must be prepared. And two groups of people are even failed to add. Now that we say we ban all conferences and everything, Are we banning churches and church meetings? Are we banning meeting of mosques? Are we banning political rallies and political groups from meetings? Because how different are these meetings from conferences? These meetings are more regular, more frequent among friends who will hug and kiss and shake. Some have traveled from anywhere, they will come back. So, one, the government response is part of an ECOWAS-wide activity. We must respect it because government is bound by ECOWAS treaties.
But we must do more. But you say that we must do more.
An independent decision of Ghana, I think I need more confirmation of why they will ban that and not ban all other things.
Right. Professor Dodo, we are very grateful for your time. I appreciate that you could join us at such a short notice. We're grateful. Professor Dodo is a consultant for the World Health Organization on vaccines. We still have Professor Gavua, who is an international relations expert. So, Professor Gavua, before I let you go, I know you've stayed on for a while and we're grateful. This is a scenario we have on our hand. There's a lot more that needs to be done. There are international students who come to our country and not go to public universities like Legon and KNUST, but they go through small colleges and institutions to learn how to speak English. The kinds of regulations that these people are subjected to is different from what those in public universities are subjected to. Can we do anything different in order to be sure that from the international relations point of view, we are capturing all these categories of people when it comes to screening?
Well, that is for Ministry of Education in particular to discuss in consultation with Ministry of Health and other stakeholders. We cannot isolate one category of students from others because they are all human beings who are coming into our country and interacting with people. What the situation is today, it's, as we keep on saying, it's a wake-up call to the entire world community of states that when we talk about security issues, international security, and in our particular case, national security, that is not limited to armed conflict alone. It's not limited to situations like we have with Boko Haram. Health has become a national security issue, and we must treat it as such. We are engulfed by filth today. Everywhere we are talking about sanitation. Now, Ebola borders on poor sanitary conditions, as we are being told. We don't know what other form of disease would emerge later on. So we have to treat this as part of the national security crisis that is we are having in the West African sub-region and invest in it. Again, it is for all of us to think through in creative and innovative ways since the world body does not have cure for it today. Perhaps with or without money, we can start thinking about how to cure Ebola or any other disease that emerges tomorrow. If we have the laboratories to test and so on and so forth. We have the human resources in our various countries in the sub-region. We can't just say we are helpless, so we keep on taking decisions that we don't think through. Right now, we can please the world. Yes, we have banned international gatherings. We are banning reopening of schools. Does it mean that international students, for example, who will compensate them for coming into the country already? Are we saying they should go back? Or are we detaining them here because we don't want others to come in? Does it mean that all other international programs that would lead to economic activity within the country, we are putting limits on that?
Professor
If we do not take time, in the long run, it will backfire on us economically. And Ebola is not the only thing affecting us today.
Professor Gavua, we're very grateful for your time. Professor Gavua is an international relations expert. So, Ms. Ampoma Isaac, let me come to you, Rap. We don't have a lot of time. And in 2 minutes, it does appear that a lot of NGOs have been putting pressure, blaming government. What are you, the coalition of NGOs on health, also doing as your contribution towards sensitization about Ebola and cholera? Of course, these are two major issues we are dealing with in Ghana now.
Well, I think the NGO community is doing their best. In the first place, the fact that I'm here talking to you is one of the mediums in which we can do. But the problem is that you need a coordinated material to begin going out to educate. It is necessary to make sure that we don't misinform.
You're coming back to the same thing. Government must provide you that information.
Not necessarily government. We need the right information. WHO could, create mediums to which online you can get access to educational materials. And of course, government, as usual, also needs to set up centers within the Ministry of Health and within the various districts where community members, churches, could even call for resource people to begin the education on Ebola. On the part of the NGO community, for instance, the Ghana Coalition of NGOs in Health, we have put together proposals to embark on a massive education where capacity of NGOs within the various communities will begin to be built and therefore engage communities in that.
Are you hopeful that this whole Ebola thing, we can manage it as a country by the way it's going? I mean, Professor Dodu raised the thing about uncoordination. You have also raised the same thing. Professor Gavwa, who is an international relations person, have raised the same thing when it comes to the ban and when it comes to international students coming in and international travelers coming in. I think we're hopeful that we're doing something right.
Fine, it is in the right direction, but of course we need to make sure we try to reflect what are the feedbacks in all these bans. To me, I think the ban is too strong. We should rather think of putting human resource in the various places
and measures in place
for detection and allow free movement.
Isaac Ampomah, I'm very grateful for your time. Isaac Ampomah is Advocacy Officer for the Coalition of NGOs. My name is Stephen Anti, and that's where we draw the curtains for today's big story. We'll be right back with an interactive segment. Stay with us.